Bismillah Rahman Rahim. In this lecture, we are going to talk about the malignant lesions of the skin. Before, I just read about the pre-malignant lesions of the skin, which were seborrheic keratitis and actinic keratosis. And now we are going to talk about the squamous cell carcinoma. So first, let's discuss about the risk factors. That's basically a lot of UV light exposure, a rare disease, that's xeroderma pigmentosum, TP53 mutations, RAS mutations, and the loss of function mutations in the NOT receptors, which transmit signals that regulate the orderly differentiation of the normal squamous epithelia. Apart from that, immunosuppression, particularly in organ transplant recipients, and immunosuppression can also be it's likely to be associated with human papillomavirus. There are some other predisposing factors like industrial carcinogens, chronic non-healing ulcers, old burn scars. So that's very important. That can come in as an MCQ, that old burn scars can lead to a malignant cancerous tumor of the skin. And what is that? That's squamous cell carcinoma, ingestion of arsenicals, and ionizing radiation. Now, the squamous cell carcinoma, when it is in situ, it appears to be a red scaling plaque, and it is likely to be in association with the prior actinic keratosis. As it gets advanced, and you can see in the picture that it gets very scaly, nodular, and hypokeratotic. And microscopically, you see highly atypical cells at all the levels of the epidermis. They can show variable degrees of differentiation from cells that are arranged in orderly lobules to anaplastic cells with foci of necrosis and dyskeratosis. So on presentation, when the patient presents, you'll likely see if it has metastasized to the regional lymph nodes. And one important note that I would like to share is that the squamous cell carcinoma can also rise at other sites apart from the skin, which is the internal sites like the oropharynx, the lung, the esophagus, the anus, the eyes, etc. And those tumors are mostly aggressive and invasive at the time of diagnosis, since they go unrecognized. The earlier lesions, they go unrecognized.